us again. We're back with Lori Sonnenberg and Lexi LoBianco, and we're going to talk about Lexi's rehabilitation after one of her vocal injuries, or maybe both of her vocal injuries, and she's going to talk us through that and give us a real insight into what that looks like. And I'll throw it over to you, Lexi. Thank you.
Sure. So back to where we ended last time. When last we met. So my first injury was real simple. Honestly, that was I didn't even feel like I needed to go back to see Bastian. That was like zap zap gone, done, gone. It was like a little blister that was gone immediately.
I was just going to say, you mentioned that you had a polyp, and
Yeah.
he said, I can just laser this off for you in the room. It'll take. So, like, did you have it? Was there any pain involved with that?
Bastian said to me, he said, you're probably going to lose your voice. I never lost my speaking voice. Not once. I've even when with my hemorrhage, I've never lost my speaking voice.
Wow.
And I attribute that to the way my teacher taught me. And but this is the thing. I go back to the fact that I spent 5 years just crafting my technique, which is why I didn't do a lot of young artist programs. So I kind of stopped singing. I made the transition from mezzo to soprano. I just focused in on my technique, and I really built a foundational system and muscularity and understanding of my being to be able to do this for that time. And then when I went in for this issue, he was like, this is not bad singing. You've just been singing too much. And that's coming from one of the top ENTs in the world, not just, ENT Tuesday. But which they're wonderful, but Bastian's still incredible, for singers. And that made me feel really good. What that didn't do was alleviate my fear. So going into the next year was, is this gonna happen again? And so I was tentative. I didn't trust myself. So 26.
I mean, was there any recovery time, or like once the polyp was lasered off?
2 weeks, literally.
2 weeks.
But I never lost my voice. I had 2 weeks where I was reviewing Trovatore in my brain and was getting that back ready to go, and was still able to sing a little bit. After like 3 days, I was back singing, and then 2 weeks later, I was back singing full. There was almost no recovery time. Everything was fine. And then I was at the Met, and I was covering Trovatore, and that was crazy because it was my first contract there, and you never want to let anybody know, oh my God, no, I can't tell anybody, it just happened to me. And I'm going like constant in panic mode, going, how am I going to get through this? And then I had to go right into something else. I don't remember what. And that was the year I ended up jumping in, and I went to Vienna, and I was covering Turandot, and Thomas Lausman met me in the hallway on one Saturday morning and said, oh, Frau LoBianco, you know Fidelio? Yes. Okay, good. We put you in on Monday. What? So
wow.
It's the same. And when you're dealing, especially as singers, where if you are not quite one of the top 1%ers, or you're not a young artist and you're somewhere in between, and you're handed all these jump in opportunities, and you're told, can you do this? Can you jump in for this? That's trauma on our body. That is a traumatic experience for most of us that we don't think about as trauma. But the mental and emotional ability to go, okay, I have 9 days of preparation and 5 days of rehearsal to jump in for a role I haven't sung in 2 years. How in the world am I going to do this? That was insane that year. So that was post polyp. So I built my stamina back up. I built my courage, my confidence, my bravado, for lack of a better term, back up that year. And so I built my bravado back up. I kept going, and things were going great, moving. Pandemic happened. Life changed. I came out of pandemic. I went back to work. Great. I went back to work, and then my separation from my ex happened. I don't want to disparage him, and I don't want to disparage the relationship, but it was not healthy. I'll put it that way.
Sure.
It was not good. I was really broken. For many, many, many reasons. When you're dealing with feminine issues, and that happens to be the same tissue as your vocal cords, and your body's shutting down, and you're trying to just say, I can do this, and prove to the industry that you're viable, and because you're on the cusp of something bigger. And then everything goes snap, literally.
Yeah.
I was lucky to have really amazing friends who took me in. I had incredible people who said, this is the person that saved my technique. Here, go back to them, because I had sent that person to Bastion in the first place. And then I contacted Lori and I said, I don't know what to do. And I was in therapy. Also having a therapist is really incredibly important if you are dealing with anything. That's part of the team. It's not just vocal health. It is mental, emotional, and spiritual health. As a singer, we need to value that part of it as well. That is a huge part of it, because our nervous system is so intertwined with our vocal apparatus.
Sure.
Which we don't discuss as well. Our fight, flight, fawn, or freeze vagus nerve is on the back of our esophagus, and it is there. And if you are gripping with your neck, you're causing trauma. You're not in safe space even within your body. So
yeah, I think that's why, they say they call it a crash and burn when an audition goes bad.
Yes.
It's because it's like you're in that fight or flight. And yeah, I mean, thankfully it's been a long time, but it's, I do remember the days where you're like,
well, that sucked.
Unraveling, right? And it just makes so much sense because, you do feel that the cold sweats, or they're like, oh gosh, I forgot the words. And now I'm like, and now I can't breathe. Well, that's, this is all there. And yeah, lots of people do. They're very quick to say, oh, well, it's your technique, or you just never really learned how to sing, or I mean, it's very rare that somebody who never learned how to sing is going to be able to sing for 15 or 20 years. If you never learn how to sing, you might get 3 to 5, maybe. But if you never really learned how to sing, it could be, yeah, there are always things that we could do better or perfect or, do. But, people saying that they never learned, they just had a great voice and never really learned how to sing. This is armchair quarterbacking at its best, or worst.
Well, and I think everybody has been in that situation on some level or another, where I remember the first time I ever got up to sing publicly in high school, I noticed my right leg was just shaking, like shaking. And I was like, what's happening to me? And so that feeling, or you just you realized you're drenched with sweat and you're like, what is happening?
Right.
You didn't, so it has this effect of nerves combined with singing, combined with the public, combined with, the whatever else is going on in your life. So,
right.
But to get back to your story, Lexi, you got in touch with Lori and came up with a plan, I assume.
So Lori and I got in touch. The most beautiful thing I can say about what I gained from Lori was Lori said, I know the ENT who she recommended to me this time, which was Dr. Cherish in Chicago. Different ENT. Bastion's really busy. Bastion was getting ready to retire. So I needed somebody younger. I needed somebody a little bit fresher in the industry. And so she said, you have permission to keep teaching. I went, what? So I kept teaching while recovering from this injury. It was the best thing I could have done for myself, because I was utilizing all of the beautiful, incredible techniques and skills that Lori was teaching me, and then utilizing them while I was teaching to make sure that my own students were getting an even more efficient connection to their instrument. So I've now incorporated a lot of the skills that Lori has taught me into my teaching. So when I have a student who can't find a simple onset, or can't find connection to their breath, or can't feel the difference between their tongue and their larynx and their vocal cords, I can help them because of what Lori's taught me. And now I have sent a lot of my students who I can't get to that point to Lori. And I've been humbled enough that Lori has sent some of her clients to me as a voice teacher. So I can't even tell you how special it is to have someone like Lori in your corner, and to know that you have someone who understands the voice, is sympathetic to what we're going through from the industry, and also is just a beautiful human being.
Well, that doesn't hurt, for sure. That's wonderful. I mean, it is so, yeah, I just think that we come across a lot of people who are not empathetic, and who are just, either from the older generation of just being like hard-nosed, hard-lined, taskmaster, and I've always said that this is the complete opposite kind of environment we need to be in to sing in a relaxed, balanced, beautiful, vulnerable way.
There's a slowing down. There's there's a mindfulness, there's a slowing down, there's a giving yourself permission to, if all you're going to accomplish in a practice session is just how to take that breath in and turn a sound on. Like sometimes that's all we're doing is just
Sure.
coming out of that moment. Now, I want to make sure that there's something I thought of while Lexi was sharing. And, I think it's important to mention to the listeners that, a lot of times singers who get diagnosed with injuries will be referred on to for voice therapy, or speech therapy is what that goes under. And they're referred to a speech pathologist sometimes, many times, who doesn't know anything about the singing voice.
Mm.
And that can be really problematic for a singer who needs highly specialized support because you want to make sure, if you are a singer that needs voice therapy, you want to make sure that you're doing that with someone that has a lot of personal singing and even voice teaching experience. And that is really, really important, because I'm in my practice, my private practice, I work almost exclusively with singers. And a lot of the people that come in have already been through voice therapy 2 or 3 other times.
Wow.
Wow. Yeah.
With other people, and got, sometimes, they got better, and they had a little improvements here and there. And maybe they learned a lot of things about how to use their speaking voices and how to do SOVT exercises to warm up and gliding. But none of that gets translated into how does this get applied in the way that I'm singing to become more efficient and accurate and with ease. And if you don't know, if that therapist doesn't know vocal pedagogy and their way around a singing voice, technically,
Right.
it's not going to get translated. And so that is a disservice sometimes that happens to young singers and singers of all ages, where they get put in a therapy situation, and then sometimes they come away from that having a really sour taste in their mouths about therapy.
Right.
Because it didn't get me back on stage. I'm still not singing, and it's a year or 2 later.
Right. I think it's also so interesting for us to keep in mind that, and I haven't worked with a speech and language pathologist. I'm sure I would learn a lot from it. But I assume you mainly work in English, right? And with vowels and things in English, right? We've got to do French. We have to, Italian maybe is not that far. But the point being is that I was dealing with a singer and a bunch of singers not that long ago, and they were doing beautifully in the exercises, which were mainly just on vowels with a couple of, let's say Italianate consonants, M's, L's, things like that. When we had to start going into French and umlauted vowels and all this kind of stuff, the concept of using those in their warm-up for them, now these were younger singers, but the idea that if you have to say U or you have to figure out a way and use them in your exercises so that you become as comfortable in those, if you're going to sing a lot in French, as you do in your Italian A, O, E, A.
Right. And if you're working, that's right. And if you're working with a voice therapist who has knows IPA and has done all the languages and sung in all the things and done the same things that you have, then they're going to know, oh, you're singing a French roll or a French aria. Well, let's look at that. And how are we going to translate these resonance things and shaping things that we've been working on in our therapy into that specific passage or whatever you're referring to?
I love it so much. Yeah, that's great.
Can you talk a little bit about the different types of therapy that are used when you're recovering from a hemorrhage or from any type of vocal injury, so that our listeners can be a little bit more in tune into, like, these are the types of exercises, or these are the types of things that can help when you do have an injury?
Yes, absolutely. I think the most common things that we rely on in traditional voice therapy are, of course, we're going to do breathing work on some level. As we have also been coming into in the vocal pedagogy world, that it's not all about the breath. Usually,
more breath. Just give more breath.
I know. I'm gonna just gloss over that, but the reality is,
I love it.
It's rarely all about the breath. And
Right.
so, but we do incorporate breath work. I call it airflow coordination
Oh,
work.
we love that. We
I
love that on
love
this
it.
podcast. We talk about airflow and the flowing between the notes. That's where between the notes came
Yeah,
from. So yeah,
flow. We do a lot of flow
I
work.
love it. I love it.
And then there's always a resonance component. There's laryngeal coordination, like vocal fold coordination, is
Hmm.
super important because we want to get those vocal folds shaping and positioning exactly right. So we're
Right.
going to design, a good therapist is going to be able to listen to the voice in front of them, in the room with them, and assess, like, do we need to change something with this airflow thing? And then that's going to make the resonance thing fall into place. Or is it a coordination, adduction issue?
Hmm.
And there's just a lot of tinkering that goes on. But SOVTs, which are semi-occluded vocal tract exercises, they're the things we all love. And inherently, they bring better balance to the subsystems of voice, like lip trills and tongue trills and humming and buzzy consonants and all of those
Yeah.
things. Straw phonation, they work for a really good reason. And
Hmm.
so we've got a lot of science to back those things up now. And then if you're working with a more experienced singer, they probably have some experience with those things already
Yeah.
from their voice lessons, right? Because we use those in voice lessons, not just voice
Weston and
therapy.
I have taught a lot together. A little thing we like to call the H2 method with the hurt in the email. But we love raspberries because of
Oh
where
yeah.
it gets the tongue, gets the position out, it encourages the flow of the air. And sometimes people can pinch for lip trills. It's really hard to pinch for a raspberry and keep. I think it's almost impossible to do that and keep it buzzing. You
Yeah.
know.
Really
Yes.
that was one of my main therapies that Lori and I had worked on, was the raspberry. But and it's so interesting, the different types of raspberries that you can make. You can one that's really tight, which a
Ooh.
lot of young singers do, and
Oh
then
yeah.
there's the one that's really relaxed.
Well, right.
You
Yeah.
know,
Well, and then there's the students that can't even do a raspberry, and it's
Right.
like, all right, let's talk about
why?
untangling that tension in the tongue and figuring
Yeah.
out how the root of the tongue can be released. There's so many different levels of
Yeah.
of yeah.
Yeah, so
Absolutely.
voice therapy, I think it would be helpful for everyone. And I think Lexi would agree with this after going through the process with me so beautifully. She was so disciplined and so lovely and so motivated. And you have to have good teamwork in the therapist and the patient. You've got to have good teamwork. If everybody does their job, it usually works out really well.
She dealt with a
Uh,
lot of tears, a lot of tears.
Oh,
Right.
yeah.
So, but I think it's important to, like, one way to think of it is that we take the simplest, like the smallest common denominator of what good, efficient vocal function is like, to experience that, like just that kind of vibration. And we start at that smallest level with that. And then we just expand and grow the sound into all the things that we need to be able to do in singing and speech.
That's beautiful. And
I love it.
yeah,
Yeah. I just was going to say, I mean, this has been an amazing episode. And I think that, these two parts together are just like, it's a treasure trove, really, of knowledge and experience. And thank you, Lexi, for just being so vulnerable. We respect your vulnerability and we hold you high for that. And really just thank you for your insight and the recovery. Because I think there are a lot of people who might feel like, well, if I get something like this, kind of is like, okay, well, now I'm going to go find something else to do. And it does not have to be that way.
Not at
No,
all.
never.
I'm really lucky that, it took me less than 3 months to be completely back.
Wow.
Less than 3 months to be fully back after that injury. And I canceled 2 contracts. That was it.
Yeah,
I
that's
only had to
incredible.
cancel 2 contracts. And in that time, I came back, and the first thing I sang was the Mother and Hansel and Gretel after that.
Oh wow.
Yes.
Yeah.
That little ditty.
That little thing. And I
Yeah.
have Mother and Hansel and Gretel, and I have covered Aida at the Met. I've done Mariana de Leitmetzeren since. I've just did Trovatore again, which I'm happy if I never do again. For like 3 conductors I would do it with again. But I'm also getting ready to sing Lady Macbeth.
Oh, wow.
It's not, if you have an injury like this, if you come across a situation where you get into into what we might consider trouble. It's not trouble. It's just what's going on. It's a question. It's an opportunity to go, why? Instead of thinking something is wrong with me, it is an opportunity to say, what's the puzzle? Where am I holding extra in my body? Am I going through something that my body, or do, as one of my students had, was prone to hemorrhages, but it was because she had open capillaries on her vocal cords that had never been addressed.
Wow.
And so she would sneeze and have a minor hemorrhage. And once she had the hemorrhages, the little capillary openings lasered closed and cauterized, she's now singing Lirico Spinto repertoire. And no issues since. None.
Well, I guess it really brings home the phrase of know thyself, right? Like, pay attention to what your body's telling you.
Yes.
And if you have questions, go to the doctor. And if the doctor doesn't know what they're talking about, go to a different doctor.
And if you don't have a voice teacher, sorry, I was just going to say, if you don't have a voice teacher that's supporting you and helping you figure this out, find another voice teacher. I'm sorry.
Sure.
Yeah, absolutely.
You need somebody who's going to support you through this, not question you.
Yeah. No, absolutely. There are people who are so qualified to help you recover from these things. We want to keep you singing. We don't want you to have to stop. And it is possible to keep moving forward. I want to mention, Weston, as you were just talking about, like, getting help, ask for help. If you sense something's wrong, go see a doctor. I think it's important to throw out that the rule of thumb, timeline-wise, is that if you experience a very obvious change in your voice that lasts longer, get ready for this, 2 weeks, only 2 weeks. I say sometimes 2 to 3, just because that makes people feel better. But if you have a voice change where something is really noticeably different, especially in your singing, that lasts longer than 2 to 3 weeks and does not return to baseline with all the things you know how to do, all the things your teacher knows how to do, then that needs to be assessed by a voice specialist.
And when you say a voice change, like what are some of the symptoms of something that you would be worried lasting longer than 2 to 3 weeks?
Notes not coming out, loss of high soft singing is probably the most common complaint from singers with injury. Onset delays, air escape, stamina issues. But the if it's really noticeable and technical things that you know how to do don't restore the range and restore the flow and the balance, then that's a pretty obvious thing, especially because singers don't just forget how to sing.
Sure.
And so the American Academy of Otolaryngology is where that 2-week timeline comes from, by the way.
And so if a young singer or a singer of any age is experiencing these issues and it's been 2 to 3 weeks, what in your experience or in your advice would be the first step?
To mention it, it depends on the age, but if it's a really young singer and they're teen, let's talk to parents about it. Like, mention to a trusted adult in your life, a caregiver, a guardian, a parent. Absolutely, the voice teacher needs to be brought into that conversation, and then, or a choir director or someone in your life who is a guiding force in your singing life, a trusted adult who, or colleague or peer or a teacher who you can trust with that information. Ask for referrals and find out who do I need to see for this, and who do I ask for help? And hopefully those individuals that you go to will be able to advise you.
Again, thank you so much for all of your advice and for the vulnerability and for the information. And we just really, really appreciate you both sharing all of this great information for our listeners.
Thank you so much for having me.
Thank you.
Thanks for joining us on Between the Notes. Make sure you hit that subscribe button.
And join us next week for more behind-the-scenes stories, laughs, and operatic gold coming your way.